start in the next 1 minute. Apologies for some of the technical glitches we've been having, but it is my pleasure to welcome you all to this webinar. Our theme for this year, Transforming Care and Strengthening Communities, is our focus as we commemorate the World Sickle Cell Day 2025. We are going to go ahead and start, and as I said, apologies for the technical glitches. As we welcome you all to this webinar, we are really pleased to be able to commemorate the World Sickle Cell Day. As many of you will be aware or are aware, Nigeria has the highest prevalence of sickle cell disease globally. And as such, we felt it was important to add our voice to that group of persons and individuals and organizations that are creating awareness around sickle cell and contributing their quota. Sickle cell disease is a genetic disorder that affects majorly Blacks, Africans, some people within Asia and the Mediterranean. But as I said, we have the highest prevalence globally, and the importance of having a team approach, working collaboratively, and driving awareness, education, and advocacy is very key and paramount. Today, we are honored to welcome our keynote speaker. He is somebody who needs very little or no introduction within our climb and beyond. He is none other than Dr. Chinonso Egemba, popularly known as Aproko Doctor. He is an alumni of the Nnamdi Azikiwe University, a board-certified medical doctor, and a multiple award-winning content creator, a public speaker of repute, and he serves as the executive director of the 100K Club. He had some experiences that drove him and inspired him, as well as changed his course in life when he decided to take up a passionate duty to teach the everyday Nigerian or African, the Nkechis and the Emekas of the world, how to live healthier using social media, which has really impacted in all spheres of life. He continues to use behavioral change communication techniques over the years and has successfully built a community of over 6 million people across different platforms as he advances this work and lives out his passion. He is deeply passionate about health information dissemination all over the world, and he strives to ensure that he makes positive contributions towards improving healthcare delivery and minimizing health ignorance by leveraging on health education partnerships and collaborations. In 2022, his NGO, the 100K Club, facilitated the screening of 411 women for cervical cancer and was able to treat 70 of these women through his efforts. The 100K Club has paid off medical bills to the tune of 30 million naira as we speak today. He has a global reach, as I mentioned earlier, and has had the pleasure of collaborating with the Bill and Melinda Gates Foundation in New York in September 2023 as a goalkeeper partner working within the health space. His efforts have been globally recognized and awarded over the years, and this brings him immense joy, and he really enjoys engaging with the ordinary person on a day-to-day basis. So join me as we welcome our keynote speaker, Dr. Chinonso Egemba, to deliver his keynote address. Aproko Doctor, you're very welcome.
Thank you. Thank you very much. Because this is a virtual meeting, I have to ask the obligatory question. Can everyone hear me? Hello?
Yes, sir. Very well.
Yes,
okay,
we can hear you, sir.
Thank you so much. I am humbled to be the keynote speaker of this event and this speech, and more importantly so because of the profound theme, which is transforming care and strengthening communities. I also want to give thanks to you for convening this particular webinar, because it actually shows just how much we want to transform the lives of people who are living with sickle cell. And that's because I believe that the World Sickle Cell Day isn't just a calendar date. It is a challenge to transform care and strengthen communities, not just policies, but from policies to practice, from national directives to local power. And that's because we understand that sickle cell isn't rare. Might be rare in other parts of the world, but in Nigeria alone, over 150 babies are born with sickle cell disease every year. And far too many of these children do not live past 5 years of age. This is often because diagnosis is late, care is inconsistent, and ignorance, more importantly, breeds stigma. But if we're going to inspire change, especially with these people, we must do a couple of things first. The first that we need to do is to detect early and save lives. And this includes pushing policies like expanding universal newborn screening, especially in this part of the world. And this would have some local impact in the fact that early diagnosis will pave the way for, early intervention that will help children thrive and not just survive. Another thing that also needs to be done is that we need to deliver comprehensive care. One of the policies that might actually help to ensure that this happens is to make specialized sickle cell disease clinics and multidisciplinary care standard. And that's because some of the children who are born with sickle cell disease do not have access to this. This has to be standard in at least every locality and every region to ensure that people living with sickle cell disease have the opportunity to thrive and not just survive. One of the things that this will have locally is, have holistic support, especially for those people, which includes medical, psychosocial, educational support, and will keep families whole and communities strong. Another very neglected aspect is work, right? We need to enact workplace policies that ensures that people who are sickle cell warriors have flexible hours, remote work, and paid medical leave. This is important locally because when we do this, it empowers people who are living with sickle cell to contribute meaningfully to Nigeria's growth without sacrificing their health and without feeling like they are ostracized. Stigma. And I feel like this is one particular place I'm very passionate about because I know that behaviors are born out of cultures are born out of stories that we tell ourselves, and so we need to start integrating this into school curricula and public campaigns more often. Let us infuse it into the stories that are being told to everyone. How would this have impacts locally? When teachers, when parents and neighbors understand sickle cell disease, children thrive and then myths begin to lose their power. I know we grew up in a place where when we're talking about myths surrounding sickle cell, people just believe, oh, this person is an obanje. For the international people that might be in this, audience, that might be, it's a local parlance that we usually use, which is wrong and denigratory in its own, right. Number 5, right? We also need to reduce the financial strain. One of the things that we need to do is push for policies that ensures that sickle cell disease care is subsidized. We also need to include it in as many insurance programs as much as possible, including the NHIS. This will help families breathe, and that's because medication isn't just a luxury, and hospital visits do not always have to end in bankruptcy. At the heart of this, right, all communities are empowered to advocate for themselves. Let local leaders start to push for this. When employers offer flexible school support students, all of it echoes a global call to action, realized locally. We also need to start advocating for some of this, early breakthroughs and even research into sickle cell disease and its treatment, so that we can also have locally compliant treatment for many of the children and many of the people who might be living with it, because currently there have been a few breakthroughs in the field of sickle cell disease. But then when it becomes locally available, it becomes cheap and easier to afford. Right? So transforming care is necessarily is not just about hospitals. It's about neighborhoods, strengthening communities, meaning equipping them for knowledge, with tools, and the agency to demand better policies, better care, and stronger safety nets. So let's move beyond awareness. We need to start to rally behind laws that mandate screening and comprehensive sickle cell disease coverage, workplace that understands sickle cell disease cycles, schools that champion health equity, families that advocate with confidence. And I hope that this year is the year that policies meet communities where they are and global advocacy meets local impact, so that every person who's living with sickle cell doesn't have to survive, but thrive. Thank you.
Wow, thank you very much. Wow, that was awesome. Aproko Doctor, I really, really appreciate that. I mean, you took us through quite a few things that would impact positively on sickle cell, where we would have people thriving and not surviving, where we would have mandatory testing, workplace that has options that make it easy and flexible for people to actually go to work, the schools where the teachers have better understanding, and the families and communities that support the care that these patients need so dearly. I thank you very much for that very, very enlightening and impactful and revealing keynote. Thank you, sir, very, very much.
Thank you.
So
It's my pleasure.
thank you. Thank you. So we're going to move on, and you talked about research and having locally compliant access to local products and looking at the breakthroughs that are there and looking to see what we could access locally. We have Dr. Temitope, who is on the call. I hope he's audible. Dr. Temitope, can you confirm that you were on the call? He is a consultant hematologist who works at the Lagos University Teaching Hospital. He has quite a bit of experience handling patients in this space and has been involved in some stem cell and bone marrow transplants through his work. So I'd like to call up Dr. Temitope to add his insights and perspective as we commemorate this World Sickle Cell Day. Dr. Temilade.
Yeah. Hello.
Yes, sir. Go ahead, Doc. You're on.
Yeah. Good afternoon, everyone. Good afternoon, everyone. Can you hear me?
Yes, sir. We can hear
you. Good afternoon. We can hear you, sir.
Hello.
Go ahead, Doc.
We can hear you, sir.
Oh, good afternoon. It's nice to be here.
Hello, doctor. Are you there?
It's nice to be. It's nice to be here. Thank you, Ma, for the invitation. Thank you, Dr. Egemba, the Aproko.
Seems we've lost the good doctor. Doctor, can you hear us? Okay. I'm just going to give him a few more minutes. If not, we will go ahead and take on one of our other panelists. We have quite a few experts on the line, so we might have to take somebody else and come back to him later. I'll just give him a minute or two to see if he can join us. Doctor, are you there?
Yes, I'm here now.
Okay, all right.
I was trying to see if I can use another device.
Okay, and I
Okay.
see you're in the hospital.
So,
yeah.
as I said earlier on that, yes, I'm in the hospital. Yes, I'm very close to the blood bank. So,
Okay.
as I said earlier on, I was just appreciating, thank you for the invite and appreciating the keynote speaker. And as I said earlier on, that sickle cell disease is not something we are all not familiar with. At least, that relative or someone close to us, someone in the neighborhood with sickle cell. So I'd like to first clarify that there's a difference between sickle cell disease and just sickle cell anemia and homozygous and another abnormal hemoglobin. So I hope, can you all hear me, please?
Yes, we can hear
you.
Yes, please go ahead. We can hear you. Go ahead.
Okay. All right. So as Dr. Aproko said, sickle cell disease is a non-communicable disease and is of a public health concern to everyone. Is Mali. That was according to the World Health Organization studies. And in this part of the world, the Black population, especially the sub-Saharan Africa, we have a great amount of those individuals being affected with the sickle cell gene. So in Nigeria, the prevalence is about 2 to 3%, and in total for the carrier is about 25 to 30 in Nigerian population. Okay, so what makes it scientific is that for Nigeria, because I'm relating most of my facts with Nigerian scenario. So it's been estimated that about 400,000 individuals by year 2050 will come down with it. As for present is about 150,000. So by 2050, it's estimated that about 400,000 infants will be born annually in sub-Saharan Africa. So that makes it a pressing issue, and it's going to impose a lot of significant strain on our healthcare system that is still struggling, that's not on its feet. It's going to mark a lot of strain on our resources and families, those who are struggling to even take care of themselves. Okay. I sent a. I wish I could project my the diagram I would have loved to explain so that when we all see the diagram, I can use that diagram to relate how it works and the innovation that's been done, how it comes into play. Because an understanding of that diagram will give us a better idea for the drugs that are being produced now. Okay, no, we know in the past that in the past when knowledge had not come to play about sickle cell in the past, the Yorubas will call sickle cell Abiku, the Igbos will call it Ubanje. I think the Ghanaians will call it Trake or something like that, and a lot of harmful sociocultural practices were done because of lack of ignorance about the disease condition. But thank God for knowledge and technology, things are moving now. So we have a better understanding and how it's being cared for. And there are lots of myths about the sickle cell condition that they don't go beyond the age of 25. I once had a patient who I was treating, and she was to celebrate her 25th birthday anniversary on the ward, and we could actually palpate the fear in her. And we're like, what's wrong with it? She couldn't talk until I had to take my time to come back later in the night to just sit down with her and get down to her and we'll talk. Then so like, I'm going to clock 25 in 2 days time. So I think she has like 2 more days left to live. I was like, who told you that? So I had to call her family that this particular birthday we have to make it grand, So there are a lot of cakes on the wall, drinks. So Now she's in her 30s. She's somewhere in Abuja working, so she's doing well. So for our own local perspective, what we do about sickle cell here. So we know sickle cell, the major hallmark of their complaint is the vaso-occlusive pain, which you call the bone painful crisis. So, and that is individualized. Okay, I can see my page. So can scroll up to the first, to the second, so we can see it. No, next one. This one just talks about the history. Okay. Yeah, can you just see it? So they just talked about what goes on, what plays. No, oh, yeah, this, yeah. So what goes on with sickle cell, how it effect comes to play, the complications and the adverse effect how it comes to play. So we know in sickle cell, the cells are the individual, they are in a constant state of chronic hemolysis. So it is said that the average lifestyle of the red cell of human beings should be between 100 to 120 days. But in sickle cell individuals, especially the homologous sickle cell, that is sickle cell anemic patient, the lifespan of red cells can be as low as 20, 15, 20, 30 days. So they are in the constant state of hemolysis, and as they break down their red cells, the marrow responds back. So their usual hemoglobin or PCV is not usually up to the non-sickled individual. So and this PCV varies, so it is individualized. One patient may have a regular PCV count of about 20 to 22. Some may have between 15 to 17, 28. It varies, and they're usually very stable, unlike the non-sickled individuals who will be symptomatic of the anemia. So what actually goes? So these sickle cells, when they are exposed to unfavorable conditions, maybe in hypoxic states, dehydrations, change in pH of the environment, so it affects their oxygen delivery. So they sickle. So this sickling and unsickling leads to irreversible sickling of the cells, so it distorts the red cells, and they are not able to achieve their normal shape, and then it affects their normal flow in the blood, because the normal rheology of blood. When I say rheology, as in pattern of blood flow among the blood vessels, the red cells are meant to be in the center, followed by the white cells and the platelet at the periphery. So okay, so the red cells, once they sickle, the kind of sickle cell, their surface becomes so adhesive. So the adhesions, they form, like they stick together, form different what we call tactoids or polymer. They line up together by blocking the vessels, also cling onto the wall of the vessels. So they can either they occlude the blood vessels and cause occlusion, or they break, become they occlude the blood vessels on the right. It's called the occlude blood vessels and cause occlusion, and thereby preventing blood flow, hence reduction of the nutrients, oxygen, and carrying of waste product away from the vital organs. So when they do that, so pain, there's no blood flow to the organs, and a lot of cascade occurs. If they don't occlude the blood vessels, they undergo what we call hemolysis, so the content of red cells are released into the blood. So once they are released, they move all the necessary that to mop up the excess hemoglobin being and so you have excess of what you have inside the red cells in the system. So
Hi, Doc. We're not hearing. I think we've lost audio with Doctor. We've lost audio with Doctor. That's apologies. Let's see if he comes back on. While we're waiting for Doc to come back on, in case you have any questions, which you can put on the chat, we will be accessing the chat a little bit later to address any questions or comments. So if you could kindly go into the chat box if you have any comments or questions, we would address them later. Doctor, are you back up? Wow. Okay. We have a few other panelists around. I would hate to cut Dr. short, but we need to make good use of the time. Doctor, are you back on?
I just changed my modem again to see if this will be better.
Okay, yeah, okay,
Yeah.
thank you. All right.
So as I was explaining with the diagram, that you could have occlusion following the distorted red cell being sickled, and on the left hand side you could have undergoing hemolysis, and you have depletion of the nitric oxide, and it leads to cascade of events. So the understanding of this pathophysiology, that's where the treatment, the new drugs are being produced towards achieving better standard of living for the sickle cell individuals are being targeted at. Like earlier on, I mentioned the addition of those sickle cells and platelets and reticulocytes to the vascular wall. So there are drugs that aim at that. There are drugs that aim at preventing sickling of the red cells. There are drugs that are aimed at increasing oxygenation of these red cells so that they don't just sickle. There are drugs that help even inducing hemoglobin F production so that these cells will tend to help deliver better oxygen to the tissues. So next time, because I have short time, so we're not really doing in-depth theory about it. So the next step, so this diagram just shows us the pattern of type of hemoglobin we have. From in utero, what we have is hemoglobin alpha and hemoglobin gamma. That second, I don't have a course. Oh, I don't have a course. There's one that I wrote that looks like a Y, gamma. If you notice on the left hand side where I wrote gestational age, there's this place that's circled, alpha at the top, gamma at the lower part. That gamma at the part in utero, when the baby is still within the wombs, the gamma hemoglobin rises, and by the time the child is being delivered, when child is delivered, the gamma hemoglobin drops. So part of the therapy, part of the modality of treatment is to get drugs that will help to increase and help to deliver increased oxygen delivery, and by so doing help to increase the hemoglobin F. Because there's actually a protein that is being inhibited. There's the BCL2 that cause like an apoptosis to the gene, so it makes that gamma hemoglobin to fall. But once that drug comes to play, it increases it and maintains that hemoglobin F to persist, hence increase oxygen delivery. So that's one of the effects that our famous drug that we're all familiar with, the hydroxyurea, that's one of the things it does. Okay, so the next diagram, okay. So still on the current management, so there's a diagram I'm going to show after this one that talks about our modality of treatment. As I said earlier on, based on the understanding of the pathophysiology of sickle cell, is to help increase the hemoglobin F, which helps to increase red cells and oxygen delivery, helps to rehydrate red cells, helps to prevent stickiness or addition of red cells, red to red cell, red cells to the vascular wall. Also, we also target the inflammation that occurs as a consequence or as a sequel of the hemolysis or occlusion that occurs in sickle cell. So there are drugs that help to target that. Also, there are drugs that also another aim is to also help to reduce the level of hemoglobin S contained in the red cells. Okay, and that's why we talk about those gene editing, gene addition, genetic engineering for definitive cure. So, as I said, intervention has been aimed at the red cell itself, the receptors and the addition molecules they have on their cells, and the genes that code for the production of this hemoglobin F and S and the addition molecule. Okay, so the next, I think I have a diagram after that. Okay, yes. So this is just a
Can you
hear me? Okay, sorry.
Please, can
Yeah.
you mute yourself, please? Can you mute yourself? Thank you.
So this is just a summary of what I was talking about. On the left-hand side is the pathophysiology of the what occurs in sickle cell anemia. What happens, the mutation that occurs at the position C of beta globin 6, where glutamine is exchanged for valine, and when there's oxygen, and if there's proper oxygen, the red cells are intact. But when there's oxygen reduction or when we have hypoxia, you can see the polymerization of the red cells, sickling, and causing the hemolysis of the red cells or causing the occlusion. So all this leads to ischemic perfusion problem, inflammation, vasculopathy. When it's the vasculopathy, problem to the vessels. So understanding of this is what occurs that cause all sort of complications. I know for sickle cell, complication can occur with almost everything, right from the CNS, if from the head, from the brain, you have stroke, transient ischemic attack, you have headache, you could have cognitive impairment, you could have vascular malformation, like what we call Takayasu syndrome. But presently, I'm seeing a patient now who presented with an atypical complication of sickle cell anemia. Patient just came with generalized body pain, but we were able to resolve this pain, but found out that patient blood level was just dropping drastically from 30 to 20 within 24 hours. And there was no just bleeding, no significant hemolysis. So in scoping, in trying to find out, oh, this patient had the GI bleed. When we scope, we found that this patient had a vascular malformation in the intestine. So they caused us some vascular malformations. So the idea thing, when we're treating patients, especially patients with sickle cell, we just don't just treat them as if they're abnormal or sickle cell. We treat them as normal individual. A sickle cell patient can come down with cancer. A sickle cell patient can come down with hypertension, can come down with diabetes. So we treat them whole. You don't neglect anything. Although we know sickle cell on its own has its own complication, the CNS, even the eye, the heart, the lungs, kidney. So these are the targeted areas that we do. So when we manage them, so these are what we do. So in our center here, what we do when a sickle cell patient comes to us, we first of all get the patient's history. Okay, how has it been? Have you been assessing specialist care? Have you been regular on your routine medications? What drugs are you on? Some don't assess specialist care. It's only when they have pain that they go to the nearest private hospital or go to call a nurse in the neighborhood. Just give me drugs. Some are not being cared for, okay, and some are even naive. They don't even know. They've never heard about the drug called aldosteroid, which has been around for over 40 years and been tested and proven. So we assess them, do a general checkup on them, evaluate them for organ complications, do the hemoglobin concentration to see and score them, assess them, type them. Are they the good disease or bad disease? Some will know that this kind of patient would need intense care. If a patient presents to me with an history of a previous stroke in the past or fainting or frequent crisis that necessitates hospital admission, I know I need to go a step further than other patients. Okay, so at times we may have to plan the patient for chronic blood transfusion in addition to the aldosteroid we'll start the patient for. And the indications for that, maybe a patient with previous stroke, recurrent priapism, convulsions, all sorts, or or too much frequent crisis. So we prepare them for it and manage adequately. So we also check for organ damage, check their heart, because we know they are at the risk of developing what we call pulmonary hypertension, which is pressure within the pulmonary trunk greater than 20 meters of mercury. And we don't have the facility here in Nigeria to detect, but we have our basis for the technology, which is the echocardiogram. Once we're able to detect the pressure beyond 20 millimeters of mercury, we send patient to a cardiologist, because sickle cell management is a multidisciplinary care. So we manage with the cardiologist and also pharmacists and the other healthcare providers to get involved in clinical research and trial. Because if Nigeria could have this high population of sickle gene, most companies, most developers should actually have their base being in Nigeria, and here we should be able to do more greater things than we receiving things from outside the country. Thank you.
Thank you very much, Doctor. That was very expansive. Thank you very much. Thank you very much. I hope you will stay with us as we will have some questions for you. But let me go right on to the next panelist, and you ended it on the right note with the role of the pharmacist. So we have with us the National Chair of the Association of Community Pharmacists of Nigeria. Pharmacist Eimunjeze is a seasoned community pharmacist, transformational leader with a strong background in pharmacy and public health. He's the 16th national chairman of the Association of Community Pharmacists, and he champions the expansion of pharmacist roles in national healthcare, public health advocacy, mentorship, professional ethics, as well, whilst driving impactful state, national, and I would add global initiatives. He's an accomplished pharmacist with a passion for optimal pharmaceutical care. Pharmacist Eimunjeze, could you add some words to this discussion as the national chairman of the Association of Community Pharmacists? Thank you, sir.
Yeah, thank you very much. Can you hear me?
Yes, sir, I can hear you.
Okay, thank you very much. My special thanks goes to Dr. Monica, the convener of this webinar. And also, I need to thank the two speakers, Dr. Chinonso and Temilade. I appreciate you so much. Me especially, you have touched the area. I wanted to say something. As we mark the world sickle cell disease day today, community pharmacists play a role, a supporting role to the patients and the families. We know our slogan. We'll continue to empower ourselves by getting this information, and also we protect our people. And the pathophysiology of sickle cell anemia and all that, all of us are aware of it. We'll concentrate more on what is our role, what community pharmacists can do, being the fourth liner of professional healthcare, people who are closer to the community, and we know what we're expected to do if we should maintain our slogan of protecting our people. We must key in this kind of diseases that are very, very slow burden within the Africa. And there are major role, the last speaker had made mention of that. Public awareness is very important, and education, as we are doing today. First of all, empower ourselves to know more about this disease. And also the community around us will try to provide information on the information is the key. And in community pharmacy, we practice more or less preventive therapy rather than corrective. So if I'm providing information, especially providing information such as genetic or sickle cell diseases, genotype testing, before marriage and all that, if you take that as one of the important laws and educate the public on that, and also educate them on the crises that normally come up when you are a victim, preventive measures, if you do that, and I believe the community around you will appreciate you more and more. So education is very, very key, and we can do it in many ways, either one-on-one or through educational material, organizing talks, heads, campaign, collaboration with other NGOs, as we are doing today, even schools and religious centers, our churches and all that. These are very, very important. The second one also we can indulge more in community level is medication therapy management, which the last speaker also did mention. It's very, very important. Understanding and adhering to the prescribed medications, pain management drugs, folic acid, antibiotics, and all that we normally use. These are the things that we need to provide information to the patients and even the family also. Monitoring the side effect is also very important as a part of what we're supposed to do. Even encouraging them to take a proper vaccine prophylaxis that can prevent infection that can trigger crisis in that kind of sickle cell anemia. These are the things we can do at the community level. Genetic counseling services is very, very important. And collaborating with laboratories and then testing and counseling is very, very also important. Educating the public, especially the younger ones, the younger couples, the implication of genotype compatibility and all that is very important. And that's what we're supposed to do at the community level. Psychosocial support and advocacy is also very important. Listening to some of them that are already patients, emotional support to the family and individual that are being affected is very important. And that's what we also supposed to be doing at the community level. Emergency response to pain crisis. I know how many of them that normally come to our facilities looking for all those pain killers like pentosacin injection and all that. And what we do when they come. We have statistics of people that are coming out within us that are being affected with this particular disease. We have it. It's very, very important. We keep it. We follow up with them. What do I advise them? Most of them are becoming an addict of that. What provider is to collaborate with others, working hand to hand with the physicians, hematologists, nurses, and other NGOs. If we employ multidisciplinary approach in care, our patients, our people around us will see the impact we are creating, and documenting what we have done is a public health intervention which we must do well and do. And if we should stick and know what we preach and what we do as a community pharmacist, following our slogan, we empower ourselves to protect the people. So today, as we mark this World Health Day, as a community pharmacist, we must reaffirm our commitment as a pharmacist to advocate more, educate more, so that we can fight against this sickle cell disease. And together, we can ease the burden on the affected families and empower the community with the knowledge and care they need. If you do that, you find out that you should remain relevant, and people around you will appreciate you as a trusted professional. So on that note, I thank Dr. Monica FPSN for organizing this in collaboration with ACPN and all our members that key in that register to attend this webinar. And also there's no pharmacists that are here, I believe, because I share it on my church's platform. For some of them, family that are already affected. And I also encourage the pharma company like Nimet that have a product that Secrevites. I know they donated a sample, which people within already Apapa and Apapa axis can go to Losmu 226 Idewu Street to have a free sample for some of that. Because the product is very, very important and people need it. That Secrevite is very important, and other medication also that can help them to alleviate their pain. So thank you very much. distinguished colleague, and thank you, the moderator, Dr. Monica. I appreciate you all, and God bless.
Thank you very much, National Chair of the ACPN. We really appreciate your insights and your expanding the discussion around the World Sickle Cell Day 2025. And as you said, this is a multidisciplinary approach where we all have a role to play, as elucidated through this. I'm going to very, very quickly change gears and welcome very quickly our next panelist. She's Evelyn Ahigbe Omolego. She has a bachelor's and a master's in nutrition and dietetics, and she is a member of the Nutrition Society of Nigeria, as well as the Institute of Dietetics in Nigeria. And she partners with several NGOs running malnutrition programs and has conducted several trainings to impact positively on maternal, infant, and child nutrition. She promotes healthy living and lifestyle modification to improve healthy outcomes. She currently works in Bayelsa, Yenagoa Bayelsa, at the Niger Delta University Teaching Hospital. So welcome, dietitian Evelyn Omolego. You have the floor. Evelyn, are you there? All right. I thought I saw her a few minutes ago. Okay, I'm going to very, very quickly move on. If she doesn't respond to our last panelist, maybe we'll take him and she might come back on. She might have been having some technical hitches. Let me welcome pharmacist Abayomi Anasanya. Yomi, I believe you're on the call. He leverages evidence-based approaches to improve patient health outcomes with extensive experience in multinational pharmaceutical and nutraceutical companies. He has excelled as regional sales manager, as well as brand manager, head of marketing and compliance, and he's serving as a panelist on this webinar today and will share his expertise and experiences to inform and educate us. So, pharmacist Abayomi Anasanya, you're welcome to the webinar.
Okay, good afternoon, moderator, Dr. Monica. I believe you can hear me, right?
Yes, sir, I can hear you.
Okay, great. So I also want to welcome everybody listening to us today for this at this occasion. I also appreciate Dr. Aproko, especially one of the key takeaways in terms of accessibility for individuals living with sickle cell disease. That is very important. I also appreciate Dr. Ogunnaike when the way he put us through in terms of the pathophysiology of sickle cell disease and the sickle cell anemia, and also emphasizing the multidisciplinary care that is needed in the management of the sickle cell disease. I also appreciate pharmacist Ambrose as the national chairman of ACPN. He has made it clear, he has shared with us in the way that the community pharmacy intervene in terms of what? Pharmaceutical care. We all know that sickle cell disease is an invalidating disorder with high morbidity and mortality. It leads to poor quality of life, high level of hospitalization. It also leads to what? Severe pain, as also was mentioned by Dr. Ogunnaike. Then sometimes we see mortality. I think moderator mentioned that Nigeria is one of the countries with the highest mortality in Africa also. So now, given the disease complexity, we know the mainstay in the management of sickle cell disease is hydroxyurea. But because of the complexity of this disease and the multiplicity of the pathophysiological, so there is need to also manage the symptoms or the consequences of the sickle cell disease. But before we go into that aspect, One of the important things, I'm still taking my lead from what Dr. Gunaki said, in terms of the pharmacist be playing a major role in the multidisciplinary management of a sickle cell disease patient. That is providing the right information, making available quality and affordable product that will improve the quality of life of this patient. We know in the country, in the world we had now, the world is globalized. Everybody can just go open Google, get one information, get access to that drug that is not needed, leading to polypharmacy, leading to drug-drug interaction, or even food-drug interaction. So to lay foundation to where we are going in management of consequences or symptoms that may arise or reduce the severity of this disease, there is one thing that is important. I know Madam Mrs. Evelyn will still join us, but I want to start from that. Nutrition. It is known that sickle cell disease patients require higher calorie and protein intake due to what? High energy expenditure and because of the red blood cell turnover. So good nutrition can impact positively on the what? On the quality of life of patients with sickle cell disease. So that is why even as an industrial pharmacist, as a community pharmacy, we still encourage a balanced diet that is rich in fruit, vegetables, whole grain protein sources. But the question is, with our economy, how many of us, even we that we are here today, how many of us actually take balanced diet? Somebody have also mentioned hydration. Hydration is very important, which now brings me to where I'm actually going. It is known fact, and it is well established, that there is high nutritional deficiency with people living with sickle cell disease. Because there is high nutritional deficiency, it leads to what? Complication like vaso-occlusive crisis. Vaso-occlusive crisis. That is a blockage of the blood vessel, which manifests as what? The severe pain we see in patients that have such condition. We also see it, especially in infants and children, growth retardation or bone problem. There are different ways it manifests. Then coming to where I'm going, that is where we have the issue of nutritional deficiency. How do we manage that gap? How do we manage it? That is where supplementation comes to play. And we want everybody to really pay attention. In Nigeria now, we are trying, I know that is one of the key major objectives of the chairman of ACPN also, to also control the chaotic drug distribution in Nigeria. So, because now for supplementation, quality is very important. Quality and the source of whatever you're using or you're recommending or this patient is using really matters, because it is a known fact that patient that has sickle cell diseases has what? Low level of vitamin B6. Low level of vitamin B6. And vitamin B6 is important in the M. No, we have the M and we have the globin. In the M synthesis, it's also very important. It has a potential anti-sickling effect. But when a patient, it's a congenital disease, when a patient that has sickle cell disease, he has a low level of vitamin B6. So meaning that such patient needs what? Vitamin B6. Such patients with sickle cell disease also have low level of what? Vitamin B12. And vitamin B12 is important in red blood cells formation and neurological formation. Generally, it affects every part of the body. And because sickle cell disease leads to oxidative stress, it leads to what? Hemolysis of the blood. It also causes organ damage. That is the oxidative stress. It also causes organ damage. It also leads to what? Vaso-occlusion. of the body. It also reduces NO, that is the nitric oxide. This nitric oxide is very important in fighting reactive oxygen species in the body that causes this oxidative stress. Because the antioxidant in the body, the store is already reduced. So there is a need for supplementation. That is why we need antioxidant, such as what will help us to increase the nitric oxide in the body, which the sickle cell disease reduces. L-arginine, nature's field, where I represent as L-arginine. And we know L-arginine is the precursor of nitric oxide is L-arginine. And all nature's field products are from USA, so we cannot talk about the quality is not in doubt. We have it there. So with a patient that has sickle cell disease that is on L-arginine, is able to have that nitric oxide, which is able to now prevent the severity of the vaso-occlusion, which leads to what? Painful crisis. Remember, I've mentioned B6 and B12. Folic acid, it is also known that patients with sickle cell disease or people living with sickle cell disease are low level of what? Folic acid. And it leads to what? Folic acid anemia. And there is one thing I also want us to know. The mainstay in the management of sickle cell disease is HU, that is hydroxyurea urea. And one of the major side effects or the consequence of using hydroxyurea is what we call, it leads to what? Large red blood cells, what we call macrocytosis. So the addition of folic acid to hydroxyurea prevents this. So in nature's field, we have product that we call folate. That is a combination of folic acid, vitamin B6, and vitamin B12. Even though we have what we call BMAX that also have B6 and B12. To tell you that nature's field is trying to work hand in hand with all the healthcare practitioners involved in management of sickle cell disease. We also know that people living with sickle cell disease also have it leads to what? Loss of vitamin D and zinc. So such patients need to what? To supplement with zinc and vitamin D. As you can see, it's been projected. We are also seeing that from the slide that our technical partner is doing. One of the key master antioxidants in the body is glutathione. Normally, as we age, glutathione depletes in the body. But it is known that sickle cell disease reduces the antioxidant in the body, especially glutathione. And glutathione is needed to fight this oxidative stress so that the oxidative stress will not lead to damage of the what? The retina, leading to retinopathy, or the kidney, leading to what? So we also have with us, for available to our Dr. Gunaiki, to our pharmacists, from Ambrose, to everybody here, glutathione for the management of patients that have sickle cell disease, so that the severity of this disease is managed. What are we essentially trying to do? We want to prevent high rates of hospitalization that is commonly known with what? Seen with sickle cell disease. You know, it's a chronic disease. We also want to try as much as possible what the sickle cell disease is causing to restore it back with the right quality and the right amount of what? Supplement for us to also have. Then it is well known, omega fatty acid is a well-studied supplement for people living with what? Sickle cell disease, because it has shown that it reduces frequency and severity of VO6. That is the vascular occlusive crisis. That is the blockage of the blood vessels. That means it also reduces pain. So in nature's field, we also have the omega fatty acid. We also even have the one with DHA, in addition to vitamin A. I'm just trying to use this opportunity because information really matters. And we are trying as much as possible to pass across the right information to other healthcare practitioners. And when we have such opportunity to also work, to also share with us products that several studies has been carried out that can be used in managing crisis or the symptoms that accomplishes sickle cell disease, so that the quality of life of such patient can be what? Can be improved. I really appreciate the testimony given by Dr. Ogunaike of a sickle cell patient that thought he or she will die. But with encouragement, with psychotherapy, the patient is still alive. So in saying all this, because I believe it's not only healthcare practitioner that is on this platform, we also have end users. We also have patients that have sickle cell disease. So what we advocate is this, and what we also do at the community level is this, that you should not, we advise before you can use any drug, you should consult with your what? Your healthcare practitioner, with your doctor. You don't just go and take because somebody have mentioned that this drug works for him or her, or because you saw it on Google online. It is essential you consult with your ACP before you add any medication or supplement to it, because we believe this mortality or morbidity can be improved if there's right supplementation. And with nature's field, the right supplementation is there. Is a product that is available, that is accessible in all the pharmacy nationwide. And I believe some of the HCP that are here today can attest to the quality of the product that has been shared with you. Thank you once again for this opportunity, Dr. Monica, and everybody listening.
Thank you very much. Thank you very much for taking us through the supplementation and the nutritional part. I'm going to ask quickly if Evelyn's on the call. I think I see her. In the meantime, please, if you have any questions, kindly just send them in the chat box. We are struggling with time because we want to end this promptly. But Evelyn, are you there? I had already introduced you. Evelyn Omolego, are you on the call? I saw her. Evelyn Ahigwe, unmute yourself, please. Okay, I'm not getting a response. So I'm going to have to move right on. Evelyn, are you there? Okay, I'm going to go to the chat and take the questions. We have some questions in the chat group. The first question from Agboma: how do we handle this issue of pentazocine used by sickle cell disease warriors? In a lot of cases, it leads to addiction and other serious health issue.
Yeah, I've been unmuted. Okay.
Oh, is that Evelyn? Are you there?
Yes, I've been unmuted. Yes.
Okay. Can you very, very quickly take your presentation, please? And we'll come back to these questions. Please go ahead and put your questions in the chat. For our participants, please send in your questions on the chat. If we're not able to address all the questions, we will follow up after the session, but please go ahead and put in your questions. Evelyn, can you be very, very prompt in 8 to 10 minutes so that we can be on time? Thank you very much.
Okay, thank you very much for this opportunity to be part of the World Sickle Cell Day, and we are looking at the community and awareness, and to be able to give out correct information on the management of sickle cell. So as a dietitian, we are on the verge of trying to develop new initiative to ensure that patients get the best nutritional care for management and maintenance of health, stable and proper nutrition in sickle cell. So we are advocating that such care is usually individualized. And I heard the doctor talking about supplementation. Yes, nutritional assessment is very key because we need to be very sure that each individual, each patient is well assessed so that the right and appropriate care can be given in terms of nutrition. And so because of this, each of the patient would need to get a personal or assessment, both in terms of dietary intake, in terms of biochemical investigations, in terms of clinical assessment, and also anthropometry. And it's very good for this kind of assessment to be done early, before crisis setting, and then before interventions. And this should be regular, and it should be regularly assessed, and then the intervention should also be on time. And then generally, we would recommend that a sickle cell patient should be able to access healthy food, healthy diet, or like vegetables, fruits, those that are actually in season that can give a lot of vitamin C to be able to absorb the amino acids in whatever diet the patient will be taking. So vitamin C is very key in fruits and vegetables. Iron-rich foods in fish and a protein diet, and also in legumes is very important. And also micronutrients has to be optimized, and that is also a key nutritional component of a healthy diet in terms of vegetable and fruit juices, fruit smoothie, and whole grain should be preferred rather than refined foods. And like I mentioned earlier, the awareness of importance of nutrition can never be overemphasized. And so the intervention should be early enough to prevent that may come up. So it's good that the patient is already in a very good nutritional status, so that even if the crisis will come, the impact and the complication will be minimal. Yeah, because of time, I wouldn't really want to go into a case scenario where a friend of mine that actually has a child, a son, who is a sickle cell, But, by intervention and proper nutrition and care, with optimization of a nutrient-dense food which provides, adequate folates and all of the vitamin K, vitamin C, vitamin D to keep the bones healthy and all of that, the child is actually doing well, both physically and academically. So it's very important that the key points will be for early intervention, right from diagnosis, when the child has been confirmed to be a sickle cell carrier. We don't wait for the child to fall into crisis before we start looking for intervention. Nutritional education for the parents or the caregivers and the mother is very important, so that homemade food should be optimized, well-dense, nourished food that the child will be taking to be able to, provide all the micronutrients, the energy, and fats also, healthy fats in things like avocado, pear, in fishes, in crayfish, seafoods also can also help, in such a situation. And then when the child is, able to have this regular diet, regularly, prepared at home, the child will definitely do well, and the crisis will be minimized. And also good household practices, that can help, the child, prevent a crisis, like the environment, the temperature condition where the child stays, and, regular monitoring of physical activities, like, excessive activity, in these children can really make their bones to be, overworked and all of that. So because of time, I would like to summarize that, nutrition is key, and we know that nutrition will really help any sickle cell carrier to live optimally, and then treatment and management will be really effective in case of crisis. So hygiene is important, hydration, drinking of water, minimizing of, sweetened beverages that can, cause, infection and other, unhealthy circumstances. So I think I've been able to speak
Thank
actually
you.
in a
Thank
conference.
you. Thank
Thank
you,
you
Evelyn.
very much.
Thank
I will share
you so
my slide. Thank you very much.
very much. Thank you very much for focusing on the need for early assessment and interventions to ensure you maintain the nutritional status. Thank you very much. I appreciate your abbreviating that. I'm very, very grateful, Evelyn. Thank you very much. We have a question here about from Agboma about the issue of pentazocine used by sickle cell disease warriors. In a lot of cases, this leads to addiction, which is another serious health issue. I'm going to ask if Dr. Aproko Doctor take this. I know he alluded to this in the keynote. Aproko Doctor.
Well done, ma'am. Okay, ma'am. Yes, love. How are you? We'll be talking. Thank you very much.
Aproko Doctor, could you address that question, please? Okay.
Hello?
Evelyn, please mute yourself. Please mute yourself. Okay. I'm not hearing a response, but is Dr. Temilade with us? I know he was in the hospital, so I doubt he would be.
Okay, I'm here.
Okay. All right.
Yeah.
Did you hear the question?
Yeah, regards how to handle
Pentazocine.
opioids. Okay. All
Yes.
right. Yeah. Well, first of all, we always advise that never do we underestimate anybody's pain, because you're not the one going through the pain.
Yes.
So first of all, you have to be very sure, at least attend to that pain first and review systematically. And as I said earlier on, that management of sickle cell anemia is a multidisciplinary approach.
Yes.
So yeah, the hematologist comes to play, the pain specialist, if need be, may come into play. The social worker, at times even the psychiatrist may have to be involved in assessing this patient. So from there, we now review the drugs, because one of the problems, because we said the hallmark of sickle cell anemia is the vaso-occlusive crisis. So at that pain, a patient has described that pain to me as eating your leg, the lower part of your leg, eating the grit and hard objects. The kind of pain they feel is what they feel around the body. Or some will say like labor pain around the body. So I have no idea, but I know it must be very, very bad. So when they get this opioids, so you kind of give them this transient relief. And why relieving the pain? They also have this euphoria-like feeling they have after the pain. So with time, if care is not taken, they get so much dependent on it and tolerance or addiction setting. So even when they have pain, they crave for it. They go for it, buy it, they can easily get it off the counter. So that's one of the roles the pharmacists have to play, because so many pharmacists out there will give it to them. I had a patient who the parents will lock him in so that he will not have access to opioids. He will just call his Okada bike men. They will just bring it in and trade to the compound for him. So, in fact, I've had a patient who takes about, I'm not exaggerating, 21 ampoules every day for about 3 years on his legs. I met that patient. When they told me, I was just in a state of shock. I didn't know what to say. So, all that needs to be reviewed, the dose of the, how is it taking it, what's the frequency of that I'm taking it. So when they have pain, normally we try to encourage our sickle cell patients as part of their lifestyle medication to learn to take at least 3 to 4 liters of water. I know telling someone to take water every day of his life will not be that easy. So I go a step further by telling them, I call them champions, because I call them champions, I call them warriors. If you get out of taking this water, box that water, maybe with juice or Fanta or Ribena, just not too sweet, but just take that fluid, drink it. One of my prophets say, drink like a fish. You know, a fish does not drink water all the days of his life, but it's in the water. So just drink that water. It helps. For every pain, the fluid is the mainstay of the management, not even the analgesia. So analgesic just relieve the pain, but that fluid is the main treatment. So the treatment of opioid addiction, it's a big one. So at times we might need to involve the psychiatry, and they may need to be admitted and admitted for detoxification, that they meant to admitted for 3, 6, even more than that, for months. And place them
Okay.
on, yes,
Okay.
and place them on other drugs. Yes.
I think this is also for you. Dr. Rita says, my nephew has been on only folic acid for about 8 years without any crisis. Is it advisable to combine it with another? And she says, great presentation. So I hope you heard the question.
Yes, ma'am. Yes, ma'am. Well, for the child to have been on folic acid with any form of crisis, the folic acid could have been the one that works, or it's possible the child has a good disease. Okay, so if you ask this child to do his or her hemoglobin quantification, you may find out that this child has a very high hemoglobin F, and that hemoglobin F may help to help with ocean delivery, so they have less pain. I've had patients who at fourth labor and want to deliver the fourth child. That's when they discover that this patient is hemoglobin SS. So they be off pain. They don't know what pain is. So, and when you now assess, when you do all this test, you find out, oh, the child will be very high hemoglobin F. So that's why they don't come down with frequent crisis. And they can't have vitamin C, they can't have B12 because because the chronic hemolysis they have high cell turnover. So they need a lot of supplement, vitamin B6, as a pharmacist and also once said. So it's not a problem. It's not too. It's never too much. If it gets too much, the body has a way of eliminating it. So
Okay.
Yeah, you can go ahead and move. Yeah.
Thank you. Another question, which I think you might have to take as well, is it Sharibi Oluwabumi is asking, is it possible to outgrow this disease condition? If yes, what age?
Well, I said earlier on, sickle cell anemia is individualized. So, but from our little experience, we find out that the more compliant they are with their medications, the hospital visits, and lifestyle medications, as they grow, they tend to get better. That's what we've come to realize. As they go, they come to get better, less pain. As long as they are seeing the specialist who is reviewing that there are no organ damages, no other problems, with time they do better. About I think the oldest patient I've seen so far is about 88, 89 for sickle cell anemia patients. About 76, 60s, they do well.
Okay, thank you.
So most of them do well. They are grow, but the pathology is still there. So it's not that maybe it's cured, but they just live a better life. Yes.
Okay, so the last comment I'm seeing on the chat group, I have a message from Chima. To celebrate the World Sickle Cell Day, sickle cell warriors can pick up free samples of nutritional supplements for sickle cell management from Nimeth Pharmaceuticals in Rosemus Pharmacy, 226 Idowu Street, Olodi, Apapa, and Robson Pharmacy, 16 Oreshogun Crescent, off Odunsi Street, Ilaje, Bariga. Only the first 10 to visit each pharmacy will be able to get it free. So I guess if you're on this call and you have a warrior that could benefit from that, that might be nice. But thank you very much. That takes questions. I'm trying to keep us on time and see how we can round this up. But before I close, I would like to invite each of our panelists to share a final thought. Just very briefly, we've taken a bit of time. Just very briefly, what would you encourage our audience, those who have joined us? What is your take? What is their takeaway from this? Can I start with you, Dr. Kemi, since I have you?
All right. My final take is to remind us again that sickle cell is a non-communicable disease, and Nigeria has a high population, and with the information we have today, we should propagate the gospel to people around us. We should keep propagating that gospel, because even I found that even among the health caregivers, we've allowed religion and cultural belief to blind our decisions. You may be aware that your partner is AS, you still want to go in, and all you have to say is we'll go in if there's any problem, we'll do genetic prenatal sampling, and we eradicate the baby. So let's propagate the gospel and see how much we can do to reduce I don't think we can eliminate it completely, but reduce the burden of sickle cell. And should we have anyone around us, please, let's refer them to the specialist to get better care. Thank you.
Okay. Thank you very much. Yomi Onasanya. Yomi, your final.
Okay, thank you once again. Yeah, I just want to emphasize the importance of the comprehensive care in sickle cell disease management. It is important that nutrition is very important as well as supplement. But like it has mentioned, hydration is very key. It is your hallmark. Then together with the supplementation. But however, I will advise everybody listening to me that before you go on to a new medication, please consult with your healthcare practitioner or professional. It's very important. Then I will also want to implore collaboration between all the healthcare providers because it's a multidisciplinary care that is needed for this sickle cell disease champions or warrior, as you may call them. Thank you once again for this opportunity.
Thank you. Evelyn, your final sentence or two. What's the takeaway for our participants?
Wow, thank you very much. My final takeaway to our audience will be that they shouldn't lose hope. There are a lot of innovations and then evidence-based practices in terms of collaborative care that can actually give the patient a good life. So they shouldn't lose hope. They should seek the care, appropriate care, and then the patient will do very well and live optimally. Thank you very much.
Thank you very much. I'll call on Aproko Doctor, Dr. Egemba Chinonso, your final words. Have we lost him, Aproko Doctor? You are muted, Dr. Egemba. Okay. Well, let me issue my remarks if he comes back up, because I see he's still online with us. I'd like to really appreciate everybody for joining us this afternoon. Most especially, Aproko Doctor has lent his voice to this effort to drive awareness and action around sickle cell disease. And all our panelists have aligned with our keynote, where we talk about the need for collaboration, a multidisciplinary approach, the need for community support and early action and intervention. I want to thank them for their time and their expertise. I want to encourage all our participants and attendees to share the knowledge we have gained today and serve as advocates as we drive transforming care and strengthening our communities through this effort. I would like to really appeal to everybody. It's just a day, but it's more than a day, and it's something that we need to live with. So this for us is the beginning. We will try to see how to advance this cause and join you all as we continue the advocacy beyond this event. So let's see how we can transform the care. Let's see how we can strengthen communities and work together to see what we can do in our own little space around sickle cell, which impacts all of us. So with that, I would appreciate everybody. Thank you for joining us, and we wish you a very pleasant rest of your day. Thank you very much.
Thank you very much, Ma. I appreciate it.
Thank you.
Thank you, audience.
Thank you. Thank you. Thank you.
Thank you very much, ma'am.
Thank everybody for joining. Awesome one. We like that. So let's see how we will join hands moving forward.
Thank you very much, Ma. Thank you.
Thank you. Grateful. Thank you.